Step number one is early detection and early intervention. Usually if we catch the skin cancer early enough, then it has not become more invasive or metastasized or spread. And usually at that point we can cure it with just surgery and it's gone. Sunscreen is definitely a vital step. We recommend typically a broad spectrum sunscreen of an SPF of 30 or greater. I think most people are pretty good about applying initially, but then making sure that you're reapplying is the key. And I think a lot of people forget that. So reapplying at least every 2 hours. Or if you're working out in the sun and you're sweating profusely, or you're swimming, or you're just constantly wet and that's washing the sunscreen off, then you want to apply it much more often. Step number 3 to preventing is avoiding the sun at its peak hours. So usually we'll say to stay out of the sun between the hours of 10 a.m. and 4 p.m. because that's when its ultraviolet index will be the highest. So if you can avoid the sun during those hours, definitely avoid tanning beds. It is not a good healthy condition to be in for your skin, and over time that does increase the risk of skin cancer, including melanoma. Because I have seen quite a few, even teenagers and adolescents that have skin cancer from presumably tanning and just being out in the sun quite a bit. Certainly checking your skin. If you notice a mole that's changing in size, shape, or color, that's typically what we'll tell our patients. If you notice anything strange or anything that's bleeding on its own or changing, then it's important to come in and be seen. So checking your skin at home is good, doing even just like monthly skin checks and making sure nothing's changing. But of course, coming in and seeing your dermatologist as well is very important.